Hello, ladies and gentlemen. Welcome to Triple N Media. I am NIK NIKAM, and this is Cardiology Update. The feature presentation is cardiac risk factors for persons undergoing non-cardiac surgery. If you are doing pre-op evaluation for a non-cardiac surgery, here are some of the important things that we need to keep in mind. First, we need to establish what kind of a heart disease that person has and is that condition stable. 90% of the time, the heart condition that we face in regular practice is coronary artery disease, arrhythmias, heart failure, and they may also be associated with devices like pacemakers or prosthetic valves. In addition, they could also have cardiac arrhythmias, which is another major important thing that we need to take into consideration, especially if they are having atrial fibrillation and if they are on blood thinners. Similarly, when patients have prosthetic valves or significant effect. So whenever we are working on a cardiac patient, we establish the anatomic diagnosis, we establish the functional diagnosis, we establish their stability, we establish their prognosis. Cardiac drugs are exceedingly important when it comes to doing a pre-op evaluation before non-cardiac surgery. These patients may be on beta blockers and antihypertensive medications which need to be regulated before, during, and after the surgery. Similarly, these patients may also be on sympathomimetic drugs which can have an effect during perioperative phase that we need to be concerned about. And most importantly, we need to be concerned about antiplatelet agents and anticoagulation regimens which need to be thoroughly controlled before, during, and after the surgery. So let us look at some other things. And when you look at the perioperative risk of cardiac patients going for non-cardiac surgery, it also depends upon the type of surgery. If a person is going for example, an aortic valve replacement or a major vascular surgery, which could be up to 5% mortality. The intermediate category involves carotid endarterectomy, head neck surgery, orthopedic surgery like hip replacement, knee replacement, or prostate surgery. There, the risk is, and we have the risk of less than 1% morbidity or mortality, which is related to non-cardiac procedures like endoscopic procedures or cataract surgery, breast surgery, or ambulatory surgery. So depending upon this type of surgery, then we categorize these patients into high risk, intermediate risk, or low risk patients. And similarly, when we evaluate a cardiac patient, if that person is unstable, if the patient has heart failure decompensated, or if the patient has an abnormal electrocardiogram suggestive of ischemia, they need complete cardiovascular evaluation by getting an echocardiogram, by getting a stress test if necessary, or even cardiac catheterization to establish their anatomical, functional, and prognostic values before we proceed with any kind of non-cardiac surgery. If they have arrhythmias or heart blocks, they need to be evaluated by a specialist so that we're not going to end up with a complete. If they have critical aortic stenosis, that needs attention before the non-cardiac surgery. And let's talk about blood thinners. If particularly the antiplatelet agents, if the person had a coronary stent. Okay, we start off with a patient who had a PCI. Then we decide, did the patient have a drug-eluting stent or a bare metal stent? And in the first 30 days, these patients should avoid surgery at any cost. If it's less than 30 days, it's a class 3 harm, and the best thing is to delay the surgery. But if it's greater than 30 days, and if the person had a bare metal stent, that person can proceed with surgery by stopping the antiplatelet. Less than 3 months, it is a class 3 indication for surgery, or best thing is to delay the surgery. If it is between 3 and 6 months, it depends upon the type of surgery and the urgency. But beyond 6 months, It's a class 1 indication to proceed with the surgery by safely stopping the antiplatelet agents for 3 to 5 days in the perioperative phase. So, ladies and gentlemen, this is a quick overview of how you evaluate a cardiac patient for a non-cardiac surgery. There are a lot of things that need to be taken into consideration. As I said, if things look complicated, just get a cardiology consult. And we have more than 200 lectures on cardiology topics. You're welcome to watch those. And thank you so much for listening to this presentation. And please do subscribe to our YouTube channel. We'll see you in the next video.